As a chemistry program or the environmental science program, we rely a lot on technology.
The technology is very important and very critical to us.
I think that technology just really helps the students link their learning better.
To understand and appreciate technology is best done, through hands-on experience.
All the students now have to have laptops and iTouches. An iTouch is about, if you don't know, it's about the same size of an iPhone, maybe a little bit smaller. And the nice thing about that is they can just keep it in their pocket. And when their patient has a lab value that comes up, or they get a new medication ordered, or they get a new patient and they really don't know much about that patient, they can just pull out their iTouch, and with a few clicks on their iTouch and some flipping through some pages, they can pretty much know what's going on with that patient.
Okay, Matt, pulse was 85 and respirations were 19.
All right. I'm going to check the IV pumps, and the lactated ringer is at 75 and it should be at 125 according to the order, so I'll change it.
We also have, of course, the Dunnigan simulation lab, which is all high-tech now, has all the newest equipment in it. We are able to simulate patients of all different ages, with different medical issues, different genders. He can be a boy or a girl. So for example, we really want our students to respond to a patient who's having chest pain appropriately. But we can't go to a patient and say, would you please have chest pain today? So what we do is SimMan is more than happy to have chest pain. He can have it as many times in a day as we ask him to.
Our students are getting, first-hand experience in using modern approaches, modern kinds of technology to address questions in the biological sciences. This is important not only because it's certainly giving them a sense of how biology is done, but many of these students in our classrooms today are going on to graduate programs and doing research where the expectation is that they will know those kinds of techniques, know how to use those new technologies, and know what the application of those technologies are. So it's one thing to talk about in a textbook or in a lab setting what this piece of equipment or that piece of equipment will do for you. It's another thing to actually begin to use this equipment.
This lab is part of the Dunnigan grant money that was generously donated. To have a space like this has been really, really helpful to our department. First of all, it helps us to recruit some really good students because they see that we have really good space where they can really do some experiential learning. It's really allowed us to give the student a really good preparation. One of the telltale signs is that when students go to a graduate program, they often tell us that they're better prepared than some of the master's students who are in that same program. For either graduate school or even going out into the profession, we really have the opportunity to prepare our students at least to use equipment and to better have the tools to work with their clients, whether it's in a fitness setting or in a clinical setting.
Molecules are small, and so the ability to go out and see and identify what you've made or what's present in the river is of critical importance to someone who wants to work in this field. That instrument, it's a triple quadrupole mass spectrometer with an electrospray ionization source connected to a liquid chromatograph. It allows you to look for very, very small amounts of volatile molecules in anything. It was purchased to do the project that we're working on in looking at pharmaceutical and personal care products and pesticides in the Wabash River at the Veteran Conservation Park. The one with the pill, in terms of identifying counterfeit drugs, it's a very quick thing. The pill has to pass underneath that ionization source, and immediately the mass spectrometer can tell you with 100% certainty this is in it. The other thing is an environmental type sample. The most currency used in the United States has been involved or has touched a bill that's been involved in the drug trade. And so it's very easy even to see something like cocaine on the currency used in this country. I've been here 15 years and I never thought I'd see the day that instrument would be sitting on a bench in this lab. I would say of a university of our size, there are probably 5 universities in the country of our size that would have something like that.